Welcome to our comprehensive guide on varicose veins. In this video, we'll explore what varicose veins are, why they occur, and how they are diagnosed. Varicose veins are a common condition that affects millions of people worldwide, often causing discomfort and cosmetic concerns. Understanding this condition is the first step toward effective management and treatment. Whether you or someone you know is experiencing symptoms, or you're simply curious about vascular health, this video will provide clear, accessible information to help you understand the basics. Let's begin by defining varicose veins and exploring their significance in everyday health. Varicose veins are enlarged, twisted veins that most commonly appear on the legs and feet. They develop when the valves inside the veins become weak or damaged, causing blood to pool and the veins to swell. This condition is not just a cosmetic issue. It can also lead to discomfort, pain, and sometimes more serious health problems. Varicose veins are often blue or dark purple and may bulge from the surface of the skin. Understanding what varicose veins are helps us appreciate why proper diagnosis and management are important for overall vascular health. To understand varicose veins, it's helpful to know how veins function in our circulatory system. Veins are blood vessels that carry blood back to the heart, working against gravity, especially in the legs. They contain one-way valves that prevent blood from flowing backward. When these valves fail, blood can accumulate in the veins, leading to the development of varicose veins. This disruption in normal blood flow is what causes the veins to enlarge and become visible under the skin. Varicose veins often present with a range of symptoms. The most noticeable sign is the appearance of bulging, twisted veins on the surface of the skin, usually on the legs. Other symptoms may include aching pain, heaviness, swelling, throbbing, muscle cramping, and itching around the affected veins. In some cases, the skin over the veins may become discolored or develop ulcers. Recognizing these symptoms is crucial for early diagnosis and effective treatment. Certain factors increase the risk of developing varicose veins. These include age, as vein valves may weaken over time, and genetics, since the condition often runs in families. Other risk factors are obesity, pregnancy, prolonged standing or sitting, and a sedentary lifestyle. Women are more likely to develop varicose veins than men, partly due to hormonal influences. Understanding these risk factors can help individuals take preventive measures and seek early medical advice if symptoms arise. Varicose veins form when the valves inside the veins become weak or damaged. This allows blood to flow backward and pool in the veins, causing them to stretch and enlarge. Over time, the increased pressure leads to the characteristic bulging and twisting appearance. Factors such as increased pressure from standing, hormonal changes, and genetic predisposition all contribute to the weakening of vein walls and valves. One of the most recognizable features of varicose veins is their visual appearance. They often look like blue or dark purple cords running beneath the skin, and they may bulge or twist. In some cases, smaller veins, called spider veins, may also be present, appearing as red or blue lines. The appearance can vary from mild to severe, and while some people experience only cosmetic concerns, others may have significant discomfort. Varicose veins can affect daily life in several ways. For some, they are primarily a cosmetic concern, leading to self-consciousness or embarrassment. For others, the symptoms such as pain, swelling, and heaviness can interfere with walking, standing, or other activities. In severe cases, complications like skin ulcers or blood clots may develop, requiring medical attention. Addressing varicose veins can improve both physical comfort and quality of life. It's important to know when to seek medical advice for varicose veins. If you experience persistent pain, swelling, skin changes, or ulcers near the affected veins, consult a healthcare professional. Early intervention can prevent complications and improve outcomes. Even if symptoms are mild, a doctor can provide guidance on lifestyle changes and treatment options to manage the condition effectively. Diagnosis of varicose veins begins with a thorough clinical assessment. Your doctor will ask about your symptoms, medical history, and any risk factors. A physical examination is performed, focusing on the legs while you are standing, as this makes the veins more visible. The doctor will look for signs such as bulging veins, skin discoloration, swelling, and ulcers. This initial assessment helps determine the severity of the condition and guides further diagnostic steps. During the physical examination, the doctor will inspect your legs for visible signs of varicose veins. You may be asked to stand so the veins are more prominent. The doctor will gently press on the veins to assess their firmness and check for tenderness or swelling. They may also look for skin changes, such as discoloration or ulcers, which can indicate more advanced disease. This hands-on assessment is a key part of the diagnostic process. A detailed medical history is essential in diagnosing varicose veins. Your doctor will ask about any family history of vein problems, previous blood clots, pregnancies, and lifestyle factors such as prolonged standing or sitting. They will also inquire about symptoms like pain, swelling, or skin changes. This information helps identify underlying causes and tailor the diagnostic approach to your individual needs. In addition to the physical exam, non-invasive diagnostic tools are often used to confirm the presence and severity of varicose veins. The most common tool is duplex ultrasound, which uses sound waves to create images of the veins and assess blood flow. This test helps identify faulty valves, blood clots, and the extent of vein damage. Non-invasive tests are painless and provide valuable information for planning treatment. Duplex ultrasound is the gold standard for diagnosing varicose veins. This test combines traditional ultrasound, which shows images of the veins, with Doppler ultrasound, which measures the direction and speed of blood flow. During the procedure, a technician moves a small device over your skin, sending sound waves into the body. The resulting images help doctors pinpoint areas of valve failure and blood pooling, guiding treatment decisions. While duplex ultrasound is most common, other imaging techniques may be used in special cases. These include venography, where a contrast dye is injected into the veins and x-rays are taken, and magnetic resonance venography, MRV, which uses magnetic fields to create detailed images. These tests are usually reserved for complex cases or when ultrasound results are unclear. They provide additional information about vein structure and function. Assessing the severity of varicose veins is crucial for determining the best treatment approach. Doctors use clinical findings, ultrasound results, and patient symptoms to classify the condition. Severity ranges from mild cosmetic issues to advanced disease with skin changes or ulcers. Accurate assessment ensures that treatment is tailored to each individual's needs, improving outcomes and quality of life. The CEAP classification system is widely used to categorize varicose veins. CEAP stands for clinical, etiological, anatomical, and pathophysiological. This system helps doctors describe the severity and underlying causes of venous disease. By using standardized criteria, healthcare providers can communicate more effectively and select the most appropriate treatment for each patient. The clinical component of the CEAP system divides varicose veins into stages, from C0 to C6. C0 means no visible signs, while C1 includes spider veins. C2 is for true varicose veins, C3 for swelling, C4 for skin changes, C5 for healed ulcers, and C6 for active ulcers. This staging helps doctors track disease progression and choose the right interventions at each stage. The etiological part of the CEAP system identifies the cause of varicose veins. Causes can be congenital, primary due to valve weakness, or secondary, resulting from other conditions like deep vein thrombosis. Understanding the underlying cause is important for selecting effective treatments and preventing recurrence. The anatomical and pathophysiological components of CEAP describe which veins are affected and how blood flow is disrupted. Anatomical classification identifies whether superficial, deep, or perforator veins are involved. Pathophysiological assessment determines if the problem is due to reflux, backward flow, obstruction, or both. This detailed classification supports precise diagnosis and targeted treatment. Not all leg swelling or discoloration is due to varicose veins. Doctors must consider other conditions, such as deep vein thrombosis, lymphedema, or chronic venous insufficiency. Careful examination and appropriate imaging help distinguish varicose veins from these other causes, ensuring accurate diagnosis and effective management. If left untreated, varicose veins can lead to complications such as skin ulcers, bleeding, and blood clots. Chronic venous insufficiency may develop, causing long-term swelling and skin changes. Early diagnosis and management are key to preventing these complications and maintaining vascular health. While some risk factors for varicose veins cannot be changed, lifestyle modifications can help prevent or slow their progression. Regular exercise, maintaining a healthy weight, elevating the legs, and avoiding prolonged standing or sitting are all beneficial. Wearing compression stockings may also help reduce symptoms and prevent worsening of the condition. Compression therapy is a common non-surgical treatment for varicose veins. Special stockings apply gentle pressure to the legs, helping veins move blood more efficiently. This reduces swelling, relieves discomfort, and can prevent the condition from worsening. Compression therapy is often recommended as a first-line treatment, especially for mild cases. Imaging tests are not always necessary for every patient with varicose veins. They are most useful when symptoms are severe, when there are complications, or when surgery is being considered. Imaging provides detailed information about vein structure and function, helping doctors plan the most effective treatment. If you suspect you have varicose veins, preparing for your medical appointment can help ensure a thorough evaluation. Make a list of your symptoms, note any family history of vein problems, and bring a list of medications. Wear loose clothing for easy examination of your legs. Being prepared helps your doctor make an accurate diagnosis and recommend the best treatment options. During your appointment, it's helpful to ask your doctor questions about your diagnosis and treatment options. You might ask about the severity of your condition, recommended lifestyle changes, available treatments, and potential risks or complications. Open communication ensures you understand your condition and can make informed decisions about your care. A vascular specialist is a doctor who focuses on diseases of the blood vessels, including varicose veins. They have specialized training in diagnosing and treating vein disorders. If your case is complex or requires advanced treatment, your primary care doctor may refer you to a vascular specialist for further evaluation and management. After diagnosis, regular monitoring and follow-up are important for managing varicose veins. Your doctor will check for changes in symptoms, progression of the condition, and effectiveness of treatments. Follow-up visits help catch complications early and allow for adjustments in your care plan as needed. In addition to medical treatment, self-care plays a vital role in managing varicose veins. Elevate your legs when resting, avoid crossing your legs while sitting, and wear comfortable shoes. Staying active and maintaining a healthy weight can also help reduce symptoms. These simple steps support vein health and improve your overall well-being. Early recognition of complications is essential for preventing serious outcomes. Watch for signs such as sudden swelling, redness, warmth, or pain in the legs, which could indicate a blood clot. Skin ulcers or persistent sores should also be evaluated promptly. Timely medical attention can prevent complications and support better recovery. Chronic venous insufficiency, CVI, is a long-term complication of varicose veins. It occurs when the veins cannot efficiently return blood to the heart, leading to persistent swelling, skin changes, and sometimes ulcers. CVI requires ongoing management and may involve both medical and lifestyle interventions to prevent further complications. Early diagnosis of varicose veins allows for timely intervention, reducing the risk of complications, and improving quality of life. Recognizing symptoms and seeking medical advice promptly can lead to better outcomes. Early treatment options are often less invasive and more effective, emphasizing the importance of awareness and proactive care. To summarize, diagnosing varicose veins involves a combination of clinical assessment, physical examination, medical history, and non-invasive imaging. Each step provides valuable information about the presence, severity, and underlying causes of the condition. Accurate diagnosis is the foundation for effective treatment and long-term management. Varicose veins are a common vascular condition that can cause discomfort and affect quality of life. Understanding the symptoms, risk factors, and diagnostic process empowers you to seek timely care. Remember, early diagnosis and intervention are key to preventing complications and maintaining healthy veins. Many people have questions about varicose veins, such as whether they can be prevented, if they always require treatment, or what lifestyle changes are most effective. In most cases, lifestyle modifications and compression therapy are sufficient, but severe cases may need medical intervention. Always consult your doctor for personalized advice. There are many myths about varicose veins, such as the belief that they are purely cosmetic or that only older adults are affected. In reality, varicose veins can occur at any age and may lead to serious complications if untreated. Understanding the facts helps dispel misconceptions and encourages proper care. Pregnancy is a common time for varicose veins to develop due to hormonal changes and increased pressure on the veins. Most pregnancy-related varicose veins improve after childbirth, but some may persist. Managing symptoms with lifestyle changes and compression stockings can help during pregnancy. While varicose veins are more common in women, men can also develop this condition. Men may be less likely to seek treatment, but the risks and complications are similar. Encouraging awareness and early diagnosis in men is important for preventing long-term issues. Although rare, varicose veins can occur in children, usually due to congenital vein abnormalities. Early diagnosis and specialized care are important for managing symptoms and preventing complications in young patients. Pediatric vascular specialists can provide tailored treatment plans for affected children. Let's visualize how varicose veins develop. Imagine a healthy vein with one-way valves that keep blood flowing toward the heart. When these valves weaken or fail, blood flows backward and pools in the vein. The increased pressure causes the vein to stretch, twist, and bulge, resulting in the visible varicose veins we see on the skin. This schematic helps illustrate the underlying process and why proper valve function is so important. Duplex ultrasound is a key tool for diagnosing varicose veins. This schematic shows how the test works. A technician moves a handheld probe over the skin, sending sound waves into the leg. The ultrasound machine displays images of the veins and measures blood flow. Areas with faulty valves or blood pooling are highlighted, helping doctors plan treatment. This non-invasive test is safe, painless, and highly informative. The CEAP classification system organizes varicose vein diagnosis into 4 categories: clinical, etiological, anatomical, and pathophysiological. This schematic provides a visual summary of the system, showing how each component contributes to a comprehensive diagnosis. Using CEAP helps standardize care and ensures all aspects of the disease are considered when planning treatment. Compression therapy is a cornerstone of varicose vein management. This schematic illustrates how compression stockings work. The stockings apply graduated pressure, highest at the ankle and decreasing up the leg, helping veins move blood upward. This reduces swelling, relieves symptoms, and prevents progression. The visual shows the correct way to wear stockings and the effect on blood flow. In conclusion, varicose veins are a common but manageable condition. Understanding what they are, recognizing symptoms, and knowing how they are diagnosed empowers you to take control of your vascular health. If you suspect you have varicose veins, consult a healthcare professional for evaluation and guidance. Early diagnosis and appropriate management can make a significant difference in your comfort and quality of life.